Welcome to Buffalo and Western New York's Healthy Communities Show. I'm Phil Haberstro, your host from the Wellness Institute of Greater Buffalo, and I'm so pleased today because we're going to be able to share with you a major project that is going on in the Western New York community, and I'm even more excited because I have a good friend here who is the director of the Western New York Healthy Communities Coalition, Karen Lindhall. Karen, how are you?
I'm great. Thank you,
Great
Phil.
to see you.
Good to see you.
Well, Karen, we've been friends for 20 years,
Yes.
I think now, that since you came back to Buffalo to work, et cetera. And can you just, for the audience, share a little bit about your background and kind of your career path?
Sure. So I started out my career at WCA Hospital in Jamestown, New York, where I was a community health educator. And my background, my undergrad was completed at Slippery Rock University.
The Rock.
The Rock, yes. I got my undergraduate degree in public health, and so I worked at WCA Hospital for a couple of years, and then I moved to Buffalo to work for the American Cancer Society, where I stayed there for 12 years, and I was the director of cancer control.
And I remember when you were with American Cancer Society, you did a lot of work with workplace health promotion.
We did a lot of worksite wellness, yeah, and all in the spirit of preventing cancer. So, but with a lot of the worksite wellness programs that we had, it wasn't just preventing cancer; it was preventing diabetes and heart disease as well, because there is a common denominator under that, as you know. So while I was at the American Cancer Society, I decided to go back to school. So I went to DUVille College to get my master's degree in health administration, and I decided to keep going. So I am now continuing on with working on my PhD at DUVille College. In health
Does that mean
policy.
down the road I'm going to have to say Dr. Hall?
Yeah, no, you can call me Karen. That's
Thank
okay.
you.
Yeah. Yeah, but it's been a wonderful 20 years, and just seeing how public health and population health has evolved over the years. And you and I were just talking that 20 years ago when I started out in my undergrad academic career, that we were not talking about social determinants of health, but now you cannot talk about health without talking about those specific social determinant factors.
Let me fill in a couple little pieces too, because I'm aware of your career path. So you were with American Cancer Society for 12 years, I believe you said,
was, yes.
And then you went on to the private sector?
I did. I worked at Moog in East Aurora for about 2 years, and there I ran their employee health program for all of U.S. operations.
Wow.
So that was probably had about 7,000 or 8,000 employees that worked at Moog nationwide.
Super.
So that was interesting. That was a lot of fun. So even though I was housed in East Aurora, we had different populations in different areas, from California to Costa Rica even. So it was interesting, and that was a lot of fun. It's a fantastic place to work, but I missed nonprofit. I missed doing the community work. I missed working with the general public, and so I came out of that job, and now I work for the Population Health Collaborative, and I've been there for almost 3 years.
3 years and the Population Health Collaborative, just so the audience, some may be familiar, it used to be known as the P2 of Western New York, which I'm kind of personally and professionally excited that they went to Population Health Collaborative. So let's take a few minutes then, and before we get into your day-to-day work, but let's talk a little bit about the bigger picture. What is the Population Health Collaborative, and its mission, and what is it trying to accomplish?
Well, in general terms, the mission of the Population Health Collaborative is to bring together a number of different entities, all in the spirit of improving the health of the population in Western New York. So I like to think of ourselves as a think tank. We're a small organization, and we're a neutral entity, so we don't align ourselves with any particular hospital or payer organization or anything like that. So I've also described ourselves as like the nucleus, and where we kind of have our fingers in a little bit of everything. And one of the things that we do very, very well is we bring together multiple people, multiple sectors, all for one common purpose.
So you know where that's going to go in my mind. That's the social capital building
Yes,
piece
that is, yeah.
of the organization. What are some of the larger projects, before we get to the one that you're specifically involved in, but what is the PHC, the Population Health Collaborative? By the way, we'll put their phone number up and their website up so people can learn more. But what is some of the projects that they are working on now?
So we have two major grants that are from the New York State Department of Health and from Health Research Incorporated. So the program that I manage is called FIP, which stands for Population Health Improvement Program. And there's a lot of acronyms in the health world. So it's a New York State Department of Health grant that focuses primarily on working towards improving the prevention agenda. So the New York State prevention agenda is to make New York State the healthiest state. So there's a number of different focus areas. There's a number of different goals and focus areas, and it's from chronic disease to mental health to STD prevention and HIV prevention to maternal and child health. So there's a number of different goals under there. Each goal has certain focus areas and objectives. So for our FIP, through Western New York FIP, we focus primarily on mental health and chronic disease prevention.
And I know, and I know you're aware of this, but for our viewing audience, that the New York State, the Governor Cuomo, has made health in all policies, an executive order he did, so that when people are looking at a policy, I know we've done in our region complete streets policies and things of that nature. And I also saw in the governor's State of the State that he actually had a New York wellness section. So I was kind of excited to see that, and it's great to see that piece that's happening. So we've got FIP, the Population Health Improvement Program.
Yes.
Okay, what is the other major?
The other major program is called IMPACT, and I can't exactly remember what IMPACT stands for, but that is run by my coworker Jessica Thomas, and that has like a 15 different objectives pronged approach. So it's a huge grant, really, that is challenging to manage, but she does a fantastic job. With that, it primarily focuses on prediabetes, diabetes, and blood pressure. And there's a lot of other things that come into that as well. So some of the community initiatives, they work a lot with Healthy Corner Store initiatives. There's some clinical pieces to it, getting practice facilitation up and running in certain practices. So
you've not only engaged the public health community, but you've brought the medical community, the treatment and cure side of the ledger into the equation, which I think is necessary for all of us to see the healthy future that we want. Let me ask about the challenge, though, and I know you had that global experience with Moog, but how do you feel about, and what is the thinking at the Population Health Collaborative about 8 counties? That's a lot of territory to manage.
It is a lot of territory to manage, and no two neighborhoods are alike, no two counties are alike. So when you're looking at the broad overall picture of Western New York as a whole, what are those things that we can focus on that is going to affect everyone, no matter their age, no matter their gender? You know, everyone can benefit from a complete streets program. So, but when you're looking to do some more targeted approaches, you know, then you have to know your audience and you have to know your population. And if you want to do something specifically in the senior population, well, then you sector out that population for something.
And I know that there is then, I think collectively, not just Karen and Phil, but for our whole community, there's a shared vision of a healthier population. But Karen, can you speak a little bit to where we are now? What is the status of the health of our communities, and by county maybe a little bit to the best that you can?
That's kind of, well, it can be difficult to answer that question. So if you're looking at overall health in Western New York, and if you're comparing that to the rest of New York State or even nationwide, Western New York as a whole is not all that far off from the rest of the state or nationwide in terms of, you know, obesity rates, and I'm not saying that it's good because it's not that great, but excuse me, but we're not really so much way higher or way lower. We fall kind of in the same range. But when you are pulling out certain segments of the population, when you're pulling out ages, when you're pulling out genders, when you're pulling out like maybe certain races, that's when you can start to see some of the discrepancies in there. So for example, I was just looking at some data the other day when we were looking at people over the age of 65, their blood pressure is really high.
Okay.
Their cholesterol rates are really high. So that's an area that we like to focus on, and health and all policies can help with that.
And I know I saw recently some CDC, Centers for Disease Control data that was national, but I think it reflects New York State, that on the nutrition side, only 1 in 10 across the country get the recommended servings of fruits and vegetables.
Yeah.
So I think we've got some work to do there. And then recently we also saw the Community Health Foundation and the Aspen Institute released a report where only 16% of our children are getting the recommended physical activity levels that they need in that direction.
It's really sad.
So,
Being physically active and eating right just doesn't physically help you. It's mental and it's emotional and as well. I mean, so health is not just physical health. There's a whole spectrum there.
Sure.
So,
well, what we're going to do is we're going to take a little break right now, and then we're going to come back, and we're going to speak to the Western New York Healthy Communities Coalition, which Karen heads up, and we're going to talk about very specific things that they're working towards with community organizations to address nutrition and physical activity. So please stay with us. We'll be right back. Thank you.
Weight loss, it's one of the many ways to fight osteoarthritis pain. For more information on managing pain, go to fightarthritispain.org.
So my uncle calls and he says he's dizzy and he's losing his balance. I'm like, Unc, you want me to take you to a doctor? He's like, no, I'm going to look up the symptoms. I said, your symptoms are you're dizzy and you're losing your balance. So he said, I can't get on the internet because my arm is numb. I said, well, use your good arm and dial 911. Stroke's no joke. If you or someone you love is showing symptoms of stroke, don't wait because it might be too late. Dial 911. Time lost is brain lost.
Welcome back to Western New York's Healthy Communities Show, filmed right here at the Apollo Media Studio in Buffalo, New York. I'm Phil Haberstro, the host, and my special guest today is Karen Lynn Hall, who is with the Population Health Collaborative, which we talked about in the first half of the show. But Karen, you specifically have responsibility for a coalition that has been developed. You want to talk about that to address physical activity and nutrition?
I am really, really, really excited about this coalition. And so how it got started is such an interesting story. So what we talked about before with that prevention agenda, and how my role through FIP is to support items in the prevention agenda. So one of those objectives is to reduce obesity in children and adults through community efforts. So like all wonderful ideas, how they get born, there was a bunch of people sitting around the table, and we knew that we had a goal to reduce obesity in children and adults at a regional level. So we sat around the table and just thought, what are we going to do? And so we were bouncing ideas off of each other about what we could do, what we couldn't do, what would work, what might not work. But we started doing like an initial assessment of what is going on in the region in terms of nutrition and physical activity.
So you got a baseline assessment of kind of where we are.
Yes, and we quickly found out that there is a lot happening. There's a lot happening when it comes to nutrition, physical activity efforts. And I say efforts on purpose because it's not just programs, it's policies as well, like the Complete Streets programs, or Complete Street policies, or healthy vending policies, or school nutrition policies. But then there's also a number of programs that community-based organizations do, that payers do, that hospitals have their own programs as well. So we wanted to take an inventory of everything that's going on. And we looked at worksite wellness programs, we looked at community programs, we looked at other coalitions, because there are other smaller existing coalitions, schools. We looked at all of those different sectors, and we took like an inventory of what was going on. And I don't even think we scratched the surface of what's happening. So, I mean, there's grassroots gardens efforts going on in like certain block clubs in the city. So we quickly realized that there's so much going on, and then it became apparent that not everybody knows what each other is doing. So there's so many good things happening that we wanted to connect everyone.
Right.
So if somebody's doing something in Allegheny County with a senior population that's working really well, and Orleans County wants to do something, then let's connect those two groups. If one block club has a really successful grassroots gardens program and another block club wants to do it, so let's connect them. So at all levels, from down to a block club level to even, from county to county. So we developed this Western New York Healthy Communities Coalition, and before it became known as the HCC, there's another acronym, we were calling it a coalition of coalitions because we were inviting all the different coalitions to come under this one umbrella. So the criteria, if you will, to be part of this group is that you have to do anything with nutrition, physical activity. So those are the two major themes. It's all about active living and healthy eating. So whether
and we had focused earlier that those are two areas where there's really good room for improvement in Western New York.
Yeah, there's a lot of good things that are happening, and of course there's always room for improvement with anything that we do. So the only criteria is I don't care if you work in a school, if you work with little kids, I don't care if you work in the older adult population, it doesn't matter as long as it connects back to healthy eating, nutrition, physical activity, active living, no matter what it is.
So let me slip in a shameless plug for you.
Yeah.
Give your phone number if you would. If you're an organization that's out there that wants to learn more about what other organizations do or share what you're doing, how can they reach you? What would be a good phone number?
They can just call me. And I'd be happy to talk to them. I could talk about this coalition all day, every day, and everything that we do, so they could just call me.
So organizations are free to connect with you?
Yes, there is no cost to be a part of it. We want people to get together. We want people to network, and that's a very big part of these meetings. We meet 4 times a year, and the networking piece has probably been one of the most successful pieces of this coalition so far.
So talk a little bit about building the coalition, because I've been at several of the meetings, and what were some of the challenges and things that you did to bring the coalition together?
Well, I think one of the biggest challenges that we have is narrowing our focus. So even though it's broad, it's supposed to be, have a high-level, broad outlook. Trying to narrow down certain things in certain populations, and that can be difficult to do. Whenever you're looking at at a regional level, and how can you improve the overall health of a region. So that's a challenge in of itself. So that's why we look at things from a higher level through what's called a collective impact model, which is a population health model. So we're tackling it from both ends. So we're looking at certain policies that may affect larger segments of the population, but then we're also going from the bottom up, and let's say a certain program that's targeting just preschool kids. So we've got people from all of those walks of life in together.
It's melding a comprehensive approach, right?
Yes.
You've got policy, you've got environmental changes on the radar, as well as trainings. I know you do a lot of trainings through the
trainings
programs.
can be involved with that.
And then you've got the kinds of the program types of things that are going on. How are you going to be communicating what the Healthy Communities Coalition is going to be doing?
So we have about 70 different members in the coalition right now, and we communicate with them through a monthly newsletter. So the people who are part of this coalition, there's a lot of information sharing. There's a lot of we like to highlight certain organizations who are doing really good work. There's always grant opportunities that are plugged into the newsletter. We are in the process of building up a website. It's going to be Western New York Healthy Communities.org. It's not up and running yet, but soon.
Okay. Coming soon.
Coming soon. We'll be putting a lot of the information onto that website, and we're only about, I would say, a little over a year old at this point. So we're still, in the infancy stages, but I'm very excited that in the year that we've been in existence, that we have this many people being a part of it. And it's gaining momentum, and there's good things that are coming out of it, and I think that more people come to the meetings and know what we're all about and know what we're trying to do. Then
Has there been feedback from the people that attend the meetings? What do they get out of coming to the meetings? What excites them about coming to these meetings?
I think, well, every time we do an evaluation, we hear about the networking. That people walk away with a new connection, a new partnership. It's very energizing. It's more than just introducing people in the room and where you're from and what you do. We make people get up and move because it is about physical activity. They're walking around the room. They're talking about what's going on in their agency right now. What do they need help with? So, by far, the networking piece is the most successful. The other thing that I think people like is that it's not such a general coalition where we're talking about all things population health. It's very focused on nutrition, physical activity efforts. So that's what they like, and they like that it's regional. That they're meeting people that they never would have met before.
Karen, have you been able to get all 8 counties to the table as representation from all 8 counties?
I'm very happy to say that yes, we have somebody, at least I would say at least 2 or 3 people, from every county. I'm just thinking of that right now, and yes, we do.
So this seems very consistent then with what you had talked to earlier about the idea of the role that your program is playing, of not duplicating programs, but bringing people together so that they can share, they can learn about best practices and resources from each other. Let's focus a little bit on the future. What kinds of things do you think will be coming from down the road? And I know I'm not asking you to, predict from the crystal ball, if you would, of health promotion, but what is your sense of the possibilities for the future for the coalition?
I would like this coalition to be quite the force when it comes to getting certain policies passed in the region. That if we can come out with some kind of a statement or white paper from the Western New York Healthy Communities Coalition that says, we strongly believe that, in a sugar-sweetened beverage tax, for example, then people will listen and they will, pay, they will,
And the people you're talking about here are the policymakers, the elected officials, the management people in workplaces, schools, and so on and so forth.
There's power in numbers.
Yeah.
And so, like I said, we've got about 70 people right now who represent a lot of very strong, powerful organizations and agencies throughout the county, or throughout the region. So all of us together collectively, and I think that we can be quite a powerful voice.
Collective impact.
Collective impact, yes.
Okay.
Yeah.
Do you think that, part of the challenge you and I know in prevention and health promotion is the sustainability and the investment that's required? The literature I see says only about 5 cents of every dollar that is spent on health is spent on prevention and health promotion. How do you think about that in terms of sustaining the coalition's work?
Well, right now, ironically, then the coalition, we have put no money into the coalition whatsoever. So the coalition just kind of runs itself with volunteers. So what we can do, we've got these volunteers, these people who want to be there, and just going back to the collective impact model and creating a collective voice that the prevention is so important, and nutrition, physical activity, healthy eating, active living, making our neighborhoods just greater places to live and work and play. That getting people to buy into our policy people, our decision makers, if you will, getting people to buy into that concept. And there's power in numbers, and I think that
Do you see the coalition then down the road, and I don't know, you will know, does its makeup include business leaders or any elected officials? Is that something that will be part of the future?
I would really like to see that as part of the future. Right now, I think the business community and our elected official community is lacking a little bit, so we have tried to reach out to some folks to be a part of that group, but like I said, we're only a year old, and we're growing by leaps and bounds, and so I think that in the future it's definitely a possibility to have more business leaders and other members.
So in the world of policy, and you and I are aware of this, I know, but just to make the audience aware of this, schools that get funding from the federal government, which are just about all school districts, are now required to have district wellness policies.
Yes.
So we're looking across the region, and that's one place that a foundation can come from. And then you've got plenty of experience with workplace health promotion. That moves us from the children to the adults. And then the last frontier is those that are retired, the older adults. What do you see for the older adults in the future? Do you have any thoughts on how the coalition might focus more in that area, or bring that into under their radar?
We do have some representatives from the senior services organizations.
Beautiful.
So their voice is being heard at our meetings. And one of the things that we do at these meetings is we're always asking for feedback for the populations that they serve. So when we're trying to come up with, the next thing that us as a coalition wants to focus on, the folks who are representing the senior populations, they give their opinions and let it be known that, what will work for this population and what might not work for this population. But we mentioned before about the health and all policies, and there is a piece in there about the healthy aging and what is going to work for our senior populations. So that is another avenue that we can take slide that into the coalition.
All right, so now I'm going to slide another direction.
Okay.
I know that you're a runner. You got any coaching points for any of our viewers?
Oh gosh. Okay. Well. Just get out there and do it. I guess I'm not a fast runner. I'm not a strong runner, but I do enjoy it very much. And on the days where you think, oh, I'm a little bit tired and I don't feel like it, I just put my sneakers on and go. And in about 5 minutes, I'm like, all right, I'm good.
That's good. We just wanted to be sure you were, which we know you are, a good role model. So I want to wrap up and say thank you to Karen Lynn Hall. She is with the Population Health Collaborative here in Western New York, and she heads up their Western New York Healthy Communities Coalition. And if you're an organization that is interested in that, go to the Population Health Collaborative website. We'll put that up on the screen for you. Connect with Karen. She'd love to have your organization attend our meetings, give your input. But think about this from the context of our community's challenge to better its quality of life. The health of the people is one of the best ways to measure our quality of life, and we need your help to do that. So again, thanks to Karen and all the good folks at the Population Health Collaborative and here at the Apollo Media Studio for the opportunity to share. Have a great day.